You can take the same medication for years and never feel a problem. The routine stays the same. The dose stays the same. Your checkups don't raise alarms. And yet, inside your body, something may be slowly changing in a way that doesn't show up until much later. I'm Dr. Warren Hung. On this channel, I focus on helping you understand how your body changes over time and how to protect it before small issues turn into something harder to manage. If that kind of explanation helps you think more clearly about your health, consider subscribing. It allows me to keep making these kinds of medically grounded videos. Now, here's where the misunderstanding begins. A prescription feels like a form of safety. It feels controlled, monitored, managed, and for the most part, that's true. But what often gets missed, especially after 60, is that your body does not process medications the same way it used to. The pill may be the same, but the body receiving it is not. And one of the most important organs involved in that change is your kidneys. Your kidneys have a very specific job. They filter your blood. Every minute they take in blood, remove waste, balance fluids, regulate electrolytes, and help control blood pressure. It's a continuous process. Quiet, stable, easy to overlook because it doesn't create a sensation you can feel. But this system depends on something very simple: steady blood flow and intact filtering structures. Inside each kidney are millions of tiny filtering units. You can think of them as extremely fine sieves. Blood passes through them, waste is removed, and what your body needs is returned to circulation. When you're younger, this system has a lot of reserve. It can handle fluctuations. It can adapt to stress. It can compensate without showing signs. But over time, that reserve gradually decreases. According to long-term data from studies like the Framingham Heart Study, kidney filtration tends to decline with age even in people who feel completely well. That decline is usually slow, and that's what makes it easy to miss. Because nothing dramatic happens. There's no sharp pain, no immediate signal, no obvious warning. And this is where a very common form of false reassurance comes in. I feel fine. Or, my last blood test was normal. What many people don't realize is that kidney function can decline significantly before standard lab values clearly reflect it. The body compensates. It adjusts. It maintains balance until it can't as easily. And during that period when everything still seems stable small, repeated stresses can begin to matter more than they used to. This is where medications come in. Not because medications are inherently dangerous, but because many common medications interact directly with blood flow to the kidneys, filtration pressure inside those tiny units, fluid and electrolyte balance. And when those systems are already operating with less reserve, the same medication can create more strain than it did years ago. Let me explain this in a simple way. Imagine those filtering units, again, the tiny sieves. They rely on a steady push of blood to do their job properly. Some medications reduce that pressure slightly. Some change how fluid is handled. Some affect how the kidneys regulate salts and water. Individually, these effects may be mild, but over time, and especially when combined, they can begin to alter how well those filters are working. Not enough to feel, but enough to matter. And this is where another misunderstanding happens. People often assume that if a medication were causing a problem, they would notice it, that it would feel obvious. But kidney stress rarely works that way. It tends to be acute, gradual, and easy to attribute to normal aging, a bit more fatigue, a bit more swelling, slight changes in urination patterns. These are often dismissed, or not connected back to the medication at all. Now, to be very clear, this is not about stopping medications on your own, and it's not about creating fear around treatment. Many medications are essential. They prevent serious outcomes. They are part of good medical care. But what matters, especially after 60, is understanding how your body's response to those medications may be changing over time. Because the risk is not always in the prescription itself. The risk is often in how long it's used, how it's combined with other medications, how hydration is managed, how kidney function is monitored, and whether small early signs are being recognized. And this is where I want you to start thinking differently. Not in terms of, is this medication good or bad? But in terms of, how is my body handling this now, compared to before? That shift in thinking is what protects you. Because kidney-related issues are rarely about a single moment. They're about patterns. Patterns that build slowly. Patterns that don't feel urgent. Patterns that are easy to overlook until the system is under more stress than it can comfortably handle. And once kidney function declines beyond a certain point, it becomes much harder to reverse. That's why catching these patterns early matters, especially when the triggers are things you encounter every day. And this is exactly what we're going to look at next. Not rare medications. Not unusual treatments. But 3 very common types of pills, ones that many people over 60 take regularly, that can quietly place extra strain on kidney function over time. But once you see how the first one works inside the body, the pattern becomes much easier to recognize. The first type of pill I want you to understand is something many people use without thinking twice. Number uno. Non-steroidal anti-inflammatory drugs, often called NSAIDs. These include medications like ibuprofen, naproxen, and several over-the-counter pain relievers used for joint pain, back discomfort, or headaches. For many people, these feel harmless. They're easy to access. They're familiar. They're often taken as needed for everyday aches. And when you take one, the effect is clear. Pain decreases, stiffness improves, movement feels easier. So it feels helpful. But what's happening underneath is more complex. To understand why these can affect the kidneys, we need to look at something very specific. Blood flow into the kidney filters. Remember those tiny filtering units we talked about earlier? Each one depends on a steady, well-regulated flow of blood to filter properly. Your body uses chemical signals, small messenger molecules, to control how wide or narrow the blood vessels are that feed those filters. One group of these messengers is called prostaglandins. You don't need to remember the name. Just think of them as signals that help keep blood flowing properly into the kidneys, especially when the body is under stress. Now here's the key point. NSAIDs work by blocking those signals. That's part of how they reduce inflammation and pain. But at the same time, they also reduce the signals that help maintain blood flow to the kidneys. In a younger, well-hydrated body with strong reserve, this usually doesn't create a major problem when used occasionally. The system adapts. But after 60, the situation is different. Kidney blood flow is already more sensitive. Reserve is lower, and small changes in pressure can have a larger effect. So when NSAIDs reduce those signals, the amount of blood reaching the filtering units can drop. Not dramatically, not suddenly, but enough to reduce how efficiently the kidneys are filtering. And if that happens repeatedly, over time, the effect can accumulate. There's also something else that often overlaps with this: dehydration. Even mild dehydration, something as simple as not drinking enough water during the day, or losing fluid through sweating, illness, or certain medications, can already reduce kidney blood flow. Now combine that with NSAIDs. Less fluid in the system, less signaling to keep vessels open. The result is even less blood reaching the filters. This is one of the most common patterns I see. A patient in their late 60s or early 70s comes in for routine labs. Kidney numbers are slightly worse than before. Nothing dramatic, but different. And when we go through their routine, they'll often say something like, "I've just been taking something for my knees most days." Not in excess, not misusing it, just using it regularly. And this illustrates something important. The issue is not a single dose. It's the pattern. Daily use. Repeated use. Use during times of low hydration. Use combined with other medications that also affect kidney function. These patterns can quietly shift how the kidneys are functioning. Now, to connect this back to real-life recognition, there are a few subtle signs people sometimes notice but don't connect. For example, ankles feeling slightly more swollen by the end of the day, needing to urinate less than usual, feeling a bit more fatigued than expected, blood pressure becoming slightly harder to control. None of these are specific. And that's exactly why they're often overlooked. Because each one, on its own, can be explained away. But together, they can reflect a system under mild but persistent stress. From a medical perspective, we also have clear evidence that this mechanism matters. Guidance from organizations like the National Kidney Foundation and clinical data summarized in sources such as StatPearls consistently highlight that NSAIDs can reduce kidney blood flow and contribute to acute or chronic kidney injury, especially in older adults or those with underlying conditions. Again, this does not mean never take them. That would not be realistic or appropriate. What it means is how you use them matters, especially after 60. So here are a few practical points I want you to take away from this. First, be aware of frequency. Occasional use is very different from daily use. Second, pay attention to hydration. Taking these medications when you are even slightly dehydrated increases the stress on your kidneys. Third, consider your full medication picture. If you are also taking blood pressure medications, diuretics, water pills, or medications that affect fluid balance, the combined effect can be stronger than you expect. And finally, ask the right question at your next visit. Not just, is this safe? But, how often is too often for me, given my kidney function and age? That question alone can change how these medications are used, because the answer is not the same for everyone. And that's where individualized care becomes important. Now, NSAIDs are one of the most common examples, but they're not the only ones. There is another type of medication very widely prescribed, especially for blood pressure and heart health, that interacts with the kidneys in a completely different way. And understanding that difference is just as important. But the second one is often seen as protective, which is why people rarely question it. The second type of medication is something many people over 60 are prescribed for good reason. Number dose, ACE inhibitors, and ARBs. These are medications used to manage high blood pressure, heart conditions, and in some cases, to help protect the kidneys in people with diabetes. Common examples include lisinopril, enalapril, losartan, valsartan. So right away, this creates a point of confusion. How can a medication that is often used to protect the kidneys also become a source of concern? The answer comes down to how it changes pressure inside the kidney filters. Let's go back to those filtering units again. Each one works based on a balance of pressure. Blood flows in, pressure is maintained, and filtration happens. ACE inhibitors and ARBs work by relaxing certain blood vessels in the body. That's part of how they lower blood pressure. But they also affect the tiny blood vessels leaving the kidney filters. When those vessels relax, the pressure inside the filter can drop. In many situations, that is actually helpful. It reduces long-term strain on the filtering units, especially in conditions like diabetes or long-standing hypertension. That's why these medications are widely used and often beneficial. But after 60, and especially in certain situations, this effect can go a bit too far. If overall blood flow is already reduced, if hydration is low, if other medications are involved, then the pressure inside the filter may fall below what is needed for stable filtration. And when that happens, kidney function can temporarily or sometimes persistently decline. This is one of the reasons doctors often check kidney function and potassium levels after starting or adjusting these medications. Guidelines from organizations like the American College of Cardiology, ACC, and the American Heart Association, HAA, specifically recommend monitoring kidney function when using ACE inhibitors or ARBs, because the effect is not just theoretical. It shows up in real patients. Now again, this does not mean these medications are unsafe. For many people, they are extremely important. They reduce cardiovascular risk. They help control blood pressure. They can slow certain types of kidney damage. But what matters is context, especially in older adults. Let me give you a pattern I often see. Someone is taking one of these medications for blood pressure. They've been stable for a long time. Then something changes. Maybe they get sick and don't drink enough fluids. Maybe they add another medication. Maybe their appetite decreases and their overall intake drops. Suddenly, their kidney function numbers shift. Not because the medication suddenly became bad, but because the balance it depends on has changed. And without that balance, the same medication can have a different effect. Now let's add the third type of pill. Number 3, diuretics, often called water pills. These include medications like hydrochlorothiazide, furosemide, spironolactone. These are used to reduce fluid buildup, lower blood pressure, support heart function, and they do exactly what their name suggests. They increase how much fluid your body removes through urine. This can be very helpful, especially in conditions like heart failure or significant swelling. But here's the connection to the kidneys. Diuretics reduce the amount of fluid circulating in your body. That means less volume reaching the kidneys. And just like we discussed earlier, kidney filtration depends on adequate blood flow and pressure. So, when fluid volume drops, blood flow to the kidneys can decrease. Filtration pressure can fall, and kidney function can become more sensitive. On their own, diuretics can usually be managed carefully. But this is where something important happens. These medications are often used together. An ACE inhibitor or ARB, plus a diuretic, sometimes combined with occasional NSAID used for pain. This combination is well known in clinical practice. In fact, it's sometimes referred to informally as a triple effect on the kidneys. Each one affects a different part of the system. NSAIDs reduce blood flow into the kidneys. ACE inhibitors, or ARBs, reduce pressure within the filter. Diuretics reduce overall fluid volume. Individually, each effect may be manageable, but together, they can significantly reduce the kidney's ability to maintain stable filtration, and the person taking them may not feel anything unusual right away. That's what makes this pattern so important to recognize. From a research perspective, this combined effect is well documented. Clinical literature, including data summarized in sources like StatPearls and guidance referenced by the National Kidney Foundation, highlights increased risk of acute kidney injury when these medication classes are used together, particularly in older adults. Now, let's bring this back to everyday recognition, because this is where most people miss it. You might notice feeling slightly more lightheaded when standing, reduced urine output during the day, mild swelling that seems inconsistent, blood pressure readings that fluctuate more than before, or you might notice nothing at all. And that's the point. The absence of symptoms does not mean the system is unaffected. What matters is the pattern. Multiple medications, changes in hydration, age-related decline in reserve, all interacting at the same time. So instead of thinking, which one of these is the problem, it's often more useful to think, how are these working together inside my body right now? That shift in thinking is what helps prevent problems before they become more serious. Because once kidney function declines significantly, it becomes harder to restore. And in some cases, the changes can become long-term. This is why monitoring matters, and why awareness matters. Not to create fear, but to create understanding. Because when you understand the pattern, you can adjust it. And that's exactly what we need to talk about next. Still, the real issue is rarely a single pill, it's the pattern they create when used together over time. When you step back and look at all three of these medications together, something becomes clear. The risk is not usually about one pill in isolation. It's about how the system behaves when multiple small effects start to overlap. A reduction in blood flow, a drop in filtration pressure, a decrease in fluid volume. Each one is manageable on its own. But when they happen at the same time, especially in a body that has less reserve than it used to, the kidneys have to work much harder to maintain balance. And sometimes, they can't keep up as easily. That's the pattern I want you to recognize. Not fear, not avoidance, recognition. Because once you see the pattern, you can do something about it. Let's turn this into something practical. A simple way to think about protecting your kidney function, especially after 60, is to use a short checklist. Not something complicated, just a few key points that help you stay aware of how your body is responding. First, think about medication combinations, not just individual prescriptions. If you are taking a blood pressure medication like an ACE inhibitor or ARB, the diuretic, and occasionally a pain reliever like an NSAID, that combination deserves a bit more attention. Not because it's wrong, but because it places more demand on the same system. Even something as simply as asking your doctor, are any of my medications affecting my kidneys in combination? Can lead to a more tailored plan. Second, pay attention to hydration, especially on off days. This is one of the most overlooked factors. You don't need to force large amounts of water, but you do need to be aware of situations where your fluid balance changes. For example, hot weather, illness, reduced appetite, travel days where routines shift. During those times, your kidneys are already receiving less fluid. If medications that reduce blood flow or pressure are added on top of that, the effect becomes stronger. This is often when kidney function dips temporarily. Third, understand the role of routine monitoring. Many people assume that if something were wrong, they would feel it. But as we've discussed, kidney-related changes are often silent. That's why periodic blood tests matter. Tests like creatinine, estimated filtration rate, often called eGFR, electrolyte levels. These give a clearer picture of how your kidneys are functioning over time. Guidelines from organizations such as the National Kidney Foundation emphasize regular monitoring, especially for older adults and those on medications that affect kidney function. And here's something important to keep in mind. A normal result does not always mean nothing to watch. It means, this is where you are right now. What matters just as much is how that number changes over time. Fourth, notice small changes even if they seem minor. You don't need to overanalyze every sensation. But if you begin to notice patterns such as increased fatigue without a clear reason, swelling that wasn't there before, changes in urination frequency, blood pressure becoming less stable, it's worth mentioning, not as a diagnosis, but as a signal, because these are often the kinds of early shifts that precede larger changes. Fifth, and this may be the most important shift, move from thinking in terms of safe or unsafe to thinking in terms of appropriate for me right now. Because what was appropriate at 50 may not be identical at 65. What worked well years ago may need small adjustments over time. That doesn't mean something is wrong. It means your body has changed and your care should evolve with it. Now, I want to be very clear about something before we finish. This is not about stopping medications on your own. It's not about avoiding treatment. And it's not about assuming something is already wrong. It's about understanding how systems interact. Because when you understand the system, you can work with it instead of against it. From a clinical perspective, The goal is always balance. Enough support to control blood pressure. Enough fluid regulation to prevent overload. Enough pain control to maintain quality of life, while still protecting kidney function over the long term. And that balance is not fixed. It's something that gets adjusted over time. That's why conversations matter. That's why awareness matters. And that's why small changes made early can prevent much larger problems later. If one part of this explanation felt familiar, whether it's a medication you take, a pattern you recognize, or a question you've had, feel free to share that in the comments. It often helps others realize they're not the only ones noticing the same thing. And if you want more clear, medically grounded explanations like this, especially focused on health after 60, you can subscribe to the channel. I'll continue to break these topics down in a way that's practical and easy to follow. At the end of the day, this is not about avoiding care. It's about understanding your body well enough to protect it while you still have the ability to do something about it.